Good afternoon, everyone, and welcome. My name is Kaylin Dorhauer, and I'm the project coordinator for the Montana Academic Progression in Nursing Grant. The Robert Wood Johnson Foundation Academic Progression in Nursing Grant is a 2-year, $300,000 project to advance state strategies to create a highly educated, diverse nursing workforce. Their grant was created in response to the Institute of Medicine's report, The Future of Nursing, Advancing Health, Leading Change. The APIN grant from the Robert Wood Johnson Foundation focuses on the Institute of Medicine's research-based recommendation to increase the percentage of nurses with a BSN or higher degree to 80% by 2020 in order to improve healthcare outcomes. Now, if you've been following our webinar series, we've already had 2 series which you can find on the Montana CAHN website, and today we'll be concluding with our 3rd webinar that will feature Dr. Helen Mellon from MSU College of Nursing and Dr. Jennifer Elison from Carroll's College of Nursing. So before we get started, I have a few technical details. All of your lines have been set to mute, and you may press *6 to unmute your line. And there will be a question and answer session at the end of the presentation, but feel free to type any questions that you may have into the sidebar that's located on the right side of your screen. So in order to get our webinar started, I'd like to introduce Sandy Kuntz. Sandy, if you'd like to take it away, please remember to press *6 to unmute your phone line.
Thank you, Kaylin, and good afternoon, everyone. As Kaylin mentioned, if you have followed this webinar series, you will have discovered that there are a variety of pathways to become a registered nurse. Today, we're going to talk about how an individual with a high school education and no professional nursing experience can directly apply and enter one of 2 programs in the state that offer a Bachelor of Science in Nursing degree. Both Montana State University and Carroll College offer the 4-year degree leading to licensure as a registered nurse. But first, I want to mention that today, May 6th, is the first day of National Nurses Week, a time identified by the American Nurses Association to call attention to registered nurses and their contributions to the healthcare system, both in the role they play as expert clinicians in diverse care settings and as leaders who can dramatically influence the quality of care for patients, families, populations, and communities. And you can see this year's ANA logo for National Nurses Week highlights the importance of quality, innovation, and the increasing role of technology in patient care. One way nurses celebrate this week is by doing just what we are doing today, sharing our experience and encouraging others to consider this rewarding profession. National Nurses Week ends on May 12th in recognition of a nurse pioneer who laid the foundation for professional nursing. Florence Nightingale cared for wounded soldiers during the Crimean War in 1854. She was a model nurse, well-educated, a prolific writer and communicator, a mathematician and statistician with exceptional analytical skills, a patient and population advocate who influenced policy and worked to improve harsh conditions among the most vulnerable of her day. Florence Nightingale's work personifies what the American Association of Colleges of Nursing in 2008 identified as the BSN Essentials and the framework for baccalaureate nursing education today. The essentials focus on the knowledge and skills necessary to achieve outcomes within complex healthcare systems in order to assume the role of provider of care, designer, manager, and coordinator of care, and member of the profession. So to address Essential 1, a baccalaureate nurse with a liberal education would apply a wide range of knowledge from the sciences and the arts. For example, a nurse that has studied music, painting, or dance, genetics, or physics will better understand the relationship of the arts and sciences to patient care and the human condition. For Essential 2, a nurse with quality and safety competencies is able to recognize, interrupt, evaluate, and correct healthcare errors. For Essential 3, baccalaureate education provides a basic understanding of the research process and how evidence develops to influence clinical judgment. For Essential 4, the baccalaureate nurse uses clinical information systems, the electronic health records, and other advanced technology to improve quality able to identify the determinants of health for a population or a community and works to protect members of a community from an infectious disease outbreak, an environmental hazard, or a local, national, or international disaster. Essential 8, the BSN is professionally engaged in lifelong learning and ethical conduct and behaviors. And finally, Essential 9 is a summary essential that assures the public that the BSN graduate is prepared to demonstrate clinical reasoning for safe care, ethical practice, and continuous quality improvement. The Health Resources and Services Administration Bureau of Health Professions just released data estimates of the highest degree held by RNs based on the 2000 census compared to the more recent 2008-2010 American Community Survey. Results indicate a slight but significant increase in educational level of RNs with a BSN. For instance, in 2000, approximately 40.8% of all RNs held a bachelor's degree. In 2008 to 2010, that estimate was increased by 5 percentage points. Graduate degrees also have increased from 8.9 in 2000 to 10.6, so almost 2 percentage points. But still, there is much work to accomplish in order to meet the Iowa Future of Nursing Recommendation 4. And Kaylin mentioned we are attempting with the APIN grant and nationally to increase the proportion of nurses with a BSN degree to 80% by 2020. There is excellent rationale for future nurses to pursue baccalaureate education in the Iowa Future of Nursing Report. I highly recommend purchasing a copy because it lays out an exciting future that would bring a smile even to Florence Nightingale's serious demeanor. So next, Dr. Jennifer Ewison will talk about how BSN Essentials are pursued through the Carroll College program and curriculum. So Jennifer?
Thank you, Sandy. Thank you so very much for this opportunity to share information about the baccalaureate nursing program at Carroll College. And I really thank all of you out there who are listening, who are interested in pursuing a future career as a professional nurse. I've been a nurse for over 30 years, and I think this is probably the most exciting time there is to be a nurse. There are opportunities for professional nurses in a wide variety of settings with a wide variety of populations. And as you just learned, nurses work not only to take care of people when they're sick, but to prevent illness and to promote health with individuals and communities. Nurses truly are positioned to be the movers and the shakers and the leaders in healthcare reform. And I'm awfully pleased to be able to share information with you during National Nurses Week. So let's talk first a little bit about Carroll College and then the Carroll College Nursing Program. As you can see by the picture, Carroll College is located in Helena, Montana, right in the heart of the Rocky Mountains. Carroll is a 4-year private diocesan Catholic liberal arts college which promotes an interfaith culture of engagement and service at the community, regional, and global levels. We're a residential campus with approximately 1,500 students and over 40 different majors. We're very proud of our students, our alumni, and our nursing program. This academic year marks the 40th anniversary of our baccalaureate program, and we began, as many other nursing programs in the country, as a program associated with the Sisters of Charity of Leavenworth, Kansas. From 1946 to 1969, over 1,000 students began their nursing careers at Carroll College. You can see some of the graduates from the class of 1949 in the background, and they're wearing their caps, and some are wearing their nursing capes. Our baccalaureate program began in 1973, and in the foreground of this picture, there are 3 recent Carroll College graduates looking proud and happy and certainly more comfortable in their purple scrubs. We have a long tradition of educating baccalaureate-prepared nurses, and we're accredited by the Commission on Collegiate Nursing Education and have approval by the State Board of Nursing. Many students tell me that they want to become a nurse because they really and truly care about people. Is that important? Absolutely yes. The art of nursing is based on caring, and this is an essential aspect of the profession. But nursing is also a science and requires a commitment to scholastic excellence and critical thinking. The average high school grade point average, or GPA, of students admitted to the Carroll College nursing program in 2012 was 3.6, and the average SAT composite score was 1660, and the average ACT composite score was 25. Because nursing is a high-stakes profession based in relationship, we highly recommend that you are well prepared in high school science, math, and communication skills. High school biology and chemistry are essential sciences, which lay the groundwork for college classes in anatomy, physiology, microbiology, biochemistry, pathophysiology, nutrition, and pharmacology. Your math skills are vitally important as they relate to the safe administration of medications. And I can't emphasize enough the importance of communication skills. Nurses must be able to communicate clearly with a wide variety of interprofessional team members, such as physicians, pharmacists, and social workers, and physical therapists, just to name a few. We're also the liaison, or the link, between the complex medical information and a wide variety of people. So you need to practice your writing skills, practice your verbal skills, practice your math skills, turn off your smartphone, turn off your iPad, and really focus on relating to the people around you. Because remember, nursing is based in relationship. At Carroll College, many nursing students also participate on sports teams. They participate also in Carroll College's award-winning forensics team, for example, or sing in the choir, or play in the pep band or the jazz ensemble, for example. There are many opportunities for extracurricular involvement for our nursing students, and we welcome student athletes into the nursing program and work closely with the coaches who are supportive of the idea that academics always come before athletics. We also coordinate classwork and responsibilities with the campus Reserve Officers Training Corps, or ROTC, and typically we have 2 to 3 nursing students in each class who are receiving ROTC scholarships and participating in the ROTC curriculum. We admit 44 students into each cohort or each class of nursing students. We have an annual admission process, admitting students just once a year. One of the most important things for you to know is that you must first be admitted to Carroll College as a degree-seeking student in order to apply to the nursing program. And here you see the link for the website for admission to Carroll College. Students who are interested in applying to the nursing program do so in the spring of the freshman year. And we keep very close tabs on those pre-nursing students and correspond with them on a regular basis about special activities they can be involved with, the admission process, and important dates to remember for the admission into the program. The admission process begins in the spring semester, and applications are typically due on March 1st. These are the courses which must either be completed or must be in progress by March 1st of the spring that you are applying. Anatomy and physiology, 8 credits or 2 semesters worth, and this is a lab class. A liberal arts seminar. This is a alpha seminar class at Carroll College that's required of all of our freshmen. General psychology and developmental psychology. As nurses, we use this background in psychology each and every day. College composition. This is a 4-credit class with a writing lab. Basic communication and essentials of chemistry, a 4-credit class with a lab. You must receive a grade of C or higher in all of these classes. And certainly you will complete additional science and liberal arts and humanities classes as you progress in your nursing major. But these are the classes which are considered prerequisites for admission, and they're good predictor classes for your success in the program and as a professional nurse. I mentioned before that the average high school grade point average was a 3.6, and this gives you some guidance as you contemplate making a decision to apply to the nursing program. However, once you begin college, we no longer focus on your high school grade point average. Instead, we're concerned with your college grade point average. You must have a college GPA of 2.75 or higher on a 4-point scale in order to be eligible to apply to the nursing program. And as a follow-up, the average college cumulative GPA of students admitted to the Carroll College nursing program is is about a 3.5. This is an estimate and it varies year to year. Some students enter with a 4.0 and the low range is a 2.75. Admission to any baccalaureate program in the United States is competitive. If there are more applications than there are spaces available in the nursing program, we use a priority ranking program. And here's the link to the site which describes the 4-year curriculum plan and admission and progression requirements for the nursing majors. You'll apply for admission to the nursing program on or about March 1st of your spring semester of your freshman year. We look at an entire year's worth of classes and class grades before we make our decision. And if there are more students who apply, we are going to ask you and require that you take a math test and write an essay on site. Students learn about their admission status by the end of May. And the beauty of this system is that the nursing student then has 3 full years of clinical experience prior to graduation. 3 full years of clinical experience is unique to Carroll College. The students you see in this picture are in our on-campus clinical lab. Because we respect, and all nurses respect, HIPAA and patient privacy laws, we don't ever take pictures of real patients. However, starting at the 200 level, students will learn to assess, to relate to use therapeutic communication techniques with real patients. In fact, after just 7 weeks in the fundamentals class, our 200 level students are in the hospitals, interacting with patients. Carroll College students accrue a total of 865 clinical hours, and almost 600 of those hours are with real patients. Another feature of the Carroll College nursing program is its focus on community as client. Students learn to assess and provide interventions for not only individuals, but for entire communities. This is a photo of a student who is assessing the healthcare needs of a Hutterite colony and was touring the pig barn. So you never know where your nursing is going to take you. At Carroll College, we know how important it is to design patient care which reflects the whole person. The notion of holistic, patient-centered care is essential to providing high-quality care. The Carroll nursing students are provided with opportunities for learning and incorporating a variety of traditional and non-traditional nursing interventions into their care. We're proud of our Holistic Healing Lab, which is a separate lab on our nursing floor, where students can immerse themselves in alternative healing practices, such as biofeedback, the use of a seasonal affective disorder lamp, aromatherapy, or perhaps participate in a Tai Chi or a yoga class. A 2011 graduate summed it up well by saying, I am prepared to care for the whole person, not just their condition. The first chairperson of Carroll's baccalaureate program coined this phrase, baccalaureate nurses live the liberal arts. We recognize that nurses must be savvy about the many dimensions of healthcare and the multiple factors which impact how we deliver healthcare. One of the advantages of having our campus in the capital city is that students have opportunities to be involved in the politics of healthcare. This is a picture of some of our 2013 graduates, with former Lieutenant Governor Bollinger on the top row, far left. And standing next to him is the current president of Carroll College, Dr. Tom Evans, who accompanied the senior class on the tour of the Capitol in the fall of 2012. At this place called Carroll College, our students live in Helena, either on campus or off campus, and have most of their clinical experiences in this area. The National Council Licensure Examination, or NCLEX-RN, is the exam that's taken after you've graduated from an accredited nursing school. Passing this exam allows you to refer to yourself as a registered nurse, and it's a test of basic competency in the professional nursing field. We're very proud of our consistently high first-time pass rates for our graduates. Did you know that many of the earliest nurses were men? And we're happy to say that more and more men are again joining the nursing profession. At Carroll College, we currently have a mix of 87% women and 13% men enrolled in the nursing major. All costs associated with attending Carroll College are adjusted on a yearly basis. The data you see before you reflects the current cost of application, tuition, room and board, and fees for the 2012 and 2013 year. The good news is that almost all, 95% of our students in the nursing program receive some kind of financial assistance. And our graduates get hired. Out of our current class of 40 graduates, a quarter of them have already secured jobs, and they haven't even graduated yet. Our graduates are viewed as top picks by future employers, and as you can see from this slide, they travel all over the country, and some travel internationally. While we do have some students who do a victory lap at Carroll College, most of our students graduate in 4 years, which is another way to keep the costs of a college education down. And Carroll College graduates have a 1.9% default rate on paying back student loans compared to the national rate of 9.1%. I love this quote from our 2010 graduate. I feel like I'm walking out of Carroll with the education I was expecting and then some. I feel as if I was exposed to many different aspects of care, and there was not only an emphasis on the science of nursing, but also on the art of nursing. This is a lovely and succinct way to describe the Carroll program. This photo was taken during the annual Blessing of the Hand ceremony, which is a ceremony to welcome new students into the major and welcome back our returning students in the fall. Hands are anointed with oil, and the message of, "May your hands bring hope and healing to those in your care," is given to each student. We do indeed love to hear from students, and on this slide is the contact information for the admissions department, Cynthia Thornquist, and also for myself, Jennifer Elison, here at Carroll College. I'd love to hear from you. Thank you so much. Wherever your nursing career takes you, I hope you'll feel as proud and as satisfied and as joyful about the opportunities to make a difference in people's lives as I have. Good luck to you in your future endeavors, and thank you so much for listening.
Thank you, Dr. Elison. I'd like to now announce Dr. Helen Mellon from Montana State University. And just a reminder, press *6 in order to unmute your line, Dr. Mellon. *6 to unmute your line. While we wait for Dr. Mellon to unmute her line, we have a couple of questions that came through for Carroll College. So Dr. Elison, if you'd like to answer some of those, that would be great.
I'd be happy to.
All right, we have one that says, what kind of student support is available for nursing students that are attending Carroll College? Are there tutoring sessions available or scholarships?
Yes, that is a great question. There is tremendous student support available for all students at Carroll College, whether they're nursing students or not. Free tutoring. And I know that our students who are enrolled in anatomy and physiology and chemistry and who may need some help with their writing take advantage of those services and truly benefit from them. Most of our students at Carroll, and that includes our nursing students, do indeed receive some type of financial assistance. So, yes, we also have mental health counseling available for free for students. We have a health center in case students have the flu or, break an ankle or something like that happens and they need to have health care services. Because we have fairly small classroom sizes, believe me, your professors get to know you very well and keep track of you. And if you don't show up for class, somebody might email you or call you and say, are you okay? We missed you in class the last 2 weeks. So lots of student support come from a variety of different angles on the campus.
Excellent, thanks. We have another question. Are there courses on using health information technology, or is that emphasized in clinical training?
The courses, we don't have a specific course that's called informatics or, technical training. We integrate the use of technology through all of our nursing courses. And I'll just give you an example. Starting at that 200 level, or what some people think of as all students are required to have either a smartphone or a PDA, which actually is really nice if you're needing to convince your parents that you need to get a smartphone, because we have a contract with a company called Unbound Medicine. So there are resources then that become downloaded onto that, just say your smartphone. So you would use that in clinical if maybe you're getting ready to give medication, and we know that we never give medications unless we know what the medication is. If you just can't remember, or it's a new med and you want to be rather safe than sorry, you have an opportunity then right at that point of care at the bedside to be able to look up that information before you give the medication to a patient. So the technology is integrated all the way through the curriculum. And no, we do not have a specific class called technology or informatics.
Thank you. That's very helpful. We're going to see if Dr. Mellon was able to hop on the line.
Yeah, I hope so.
All right. Well, I'll open up this question to either of you. Are there other events that you know of for National Nurses Week, or are there other activities that might be happening at your campus?
Well, I know our big activity is going to be Friday, which is our nursing recognition ceremony. We used to call it a nursing pinning ceremony for our graduates, but not all nursing students or nursing graduates decide to receive pins or to order pins. So that is a really lovely occasion, and we sort of roll our celebration of Nurses Week into that. I imagine each of the hospitals in the Helena area, and probably across the state and nation, have some type of celebration for Nurses Week. And isn't it fun that nurses get a whole week to celebrate? I think it reflects the incredible work that we do.
This is Sandy, and I think this morning I noticed on my email that I had a number of from probably book vendors, just saying Happy National Nurses Week. And often we'll hear from our senators, too, if we have worked with them on different projects or they know about us. I think also you could probably look at the Montana Nurses Association website and see activities that are going on around the state. And I agree with Dr. Ellison that the hospitals really do focus on the nurses in their that are working with them, hospital public health units. So there's a lot of ways of actually discovering it, and it'll go on all week. And then there's usually an international celebration for Florence Nightingale's birthday on the 12th. So it's really exciting to see what kinds of things people will think to do.
Thanks for sharing that, Sandy. We have another question actually for Dr. Ellison about if there are religious requirements for attending Carroll.
No, there are no religious requirements for attending Carroll College. And I would say probably, I'm making a guess here, maybe 60% of our students are Catholic and some are more devout in their Catholicism than others, and 40% of students who are not Catholic maybe belong to another faith or are just seeking knowledge in that area and are not quite sure of what their faith is. So no, that's not a requirement for application or acceptance into the college.
Okay, we have another question. Are there any population level health-based classes at Carroll?
Yes, our senior level community health class is also a class that truly does focus in on a variety of different populations, whether that's going to be the homeless population, the gay and lesbian population, the elderly population. I'm just trying to think off the top of my head here of what students are focused in on that class. But again, we kind of weave that through the curriculum, but at that senior year, your community health class is indeed a population-based focus.
Perfect. Thanks for sharing that too.
And Caitlin, I don't know if Dean Melland is on yet, but I can talk a little bit about the population focus at Montana State.
Okay, yeah.
Okay. I have been excited to see all of the types of projects that students are involved with in public health departments and also in community health agencies and school health. And I think Dr. Erlison mentioned some really excellent population focuses with the homeless, the migrant workers. Occasionally we'll have some activity around migrant health. And the other thing I know that Dr. Mellon is going to talk about are international and global health focus, and the fact that we often have these wonderful opportunities in Honduras and Haiti to take trips with our students to provide care out of the country. So there are a lot of opportunities, and I'm not sure, Dr. Ellison, if you have international experiences, but I always think that that's a wonderful addition to our public health focus.
Hello?
Oh, good.
Oh, good. We have Dr. Mellon here on the line. That's one thing that we always learn with healthcare and everything in general, that technology sometimes works towards our advantage, and sometimes we have some trouble. But we have you on the line now?
You do. Sorry about that.
No, not at all. We had a lot of great questions coming in about the Carroll program. So if you are ready to hop in, we'll go ahead and transition into what Montana State University has to offer.
Be happy to.
And welcome, everybody. I'm the missing speaker here, but I'm back. My name is Helen Mellon, and I'm Dean of the College of Nursing. Still very honored to have that role. And I am delighted to have the opportunity today to share with you a bit about the College of Nursing at MSU, and about nursing in general, I guess. Our college is somewhat unique in that we are distributed at 5 different sites around the state. You'll see there on the slide we have sites, campuses in Kalispell, Great Falls, Missoula, Billings, and Bozeman. And the college is actually administered out of Bozeman where my offices are. But we have faculty who live and work at each one of those distant sites. We have clinical facilities there, and the faculty have offices, and they're really like, in a way, separate campuses. We have a unique mission for our college, and that is on your slide there. We are very much committed to enhancing the health of the people of Montana, but certainly beyond, going all the way to a global community. And that is through educating our students to be excellent in research and practice and service. And you can see there a picture of our students when they were in Honduras earlier this year, and I'll talk a little bit more about that on a coming slide. Some of the things that are unique about the MSU College of Nursing is that we are the only public entry-level baccalaureate program in Montana. So we educate students to enter as baccalaureate-prepared nurses, not nurses who already have a 2-year degree, but our students enter here as students beginning their nursing curriculum. We also are the only program in the state that has a graduate program, and we do educate nurses to become nurse practitioners or advanced practice nurses, and that they will now be entering a program at the doctoral level, starting this fall, leading to a Doctor of Nursing Practice degree. We hope in the next few years to have in the next 1 to 2 years a program that leads nurses students who already are nurses with a 2-year degree directly through to the master's level. That's the RN to MN. And then we also have a master's degree for clinical nurse leaders. We are accredited by the Commission on Collegiate Nursing Education. That is the national accrediting organization. That is required if you want to be able to have your students access any federal loans or grants. And by far the majority of our students do
take advantage of that, as well as the many scholarships we have. And we are also approved by the Montana Board of Nursing. That is absolutely required to even be open. You must have state Board of Nursing approval, and we have both of those credentials until 2019. This next slide again shows our students who are in, I believe that was in Honduras or the Dominican Republic last fall. We do offer the opportunity for our students as second semester seniors to go overseas to have a service learning experience for about 2 weeks where they provide nursing care to vulnerable populations. We send groups of about 15 students and faculty accompany them, usually 2 faculty. As I said, last fall we had students who went to the Dominican Republic, and this spring they went to Ecuador. We also have junior students who have the opportunity to serve on our American Indian reservations right here in Montana, especially with children, pediatrics. Our juniors actually go to the Fort Peck Indian Reservation, for example, where they provide care and they get credit for some of their pediatric clinical learning experiences while there. A program that we're very proud of that we've had for about 15, 16 years is our Caring for Our Own program, or our co-op program. That's a support program for American Indian students. It provides some mentorships and scholarships, tutoring for those students. We've had about 60 students go through that program since its inception, and of those 60, about 98% have returned to the reservation to serve. Those students return to serve their native people. All students at Montana, all undergraduate students at Montana University have an opportunity to participate in some kind of a research experience. Usually they are mentored by a faculty member and assist that faculty member in their research. They work as research assistants, and oftentimes are selected to present regionally or even nationally. This is a slide showing the student presenting her research on the lung health among Blackfeet Indians. So we'll sometimes see them going to a national conference and presenting a poster, or even orally presenting what we call a podium presentation. So that's excellent preparation for their role as professional nurses, whether they go on to graduate school or not. We certainly believe all students and graduates need to be prepared to participate in research or with further education to actually initiate research studies. We do, I want to talk now a little bit about application, how you get into our program, and we do actually admit students to our program twice a year. This is all on our web, and I realize there's a lot on this slide, but I think it's important to see that students are admitted a year in advance. So if a student was wanting to begin studies in the fall of 2014, the applications are actually due a year in advance in August of 2013, and that is because students need about a year to prepare to get ready to go out to one of those distant campuses, because not all the students stay on our Bozeman campus. In fact, very few do. And this slide that gives you a lot of those details, and that, as does that website, as to the very important deadlines. And I can't stress enough how important it is to attend to those deadlines and make sure that you're communicating with one of the support advisors in the college to make sure you're getting the necessary information to the college as you go through that application process. When a student is interested in being admitted to the nursing major, oftentimes the student does begin right here on the Bozeman campus. Certainly the student does not need to do that, but when they do enroll in MSU, they can claim nursing, declare nursing as a major, and they're then considered a pre-nursing major. They are not a nursing major until they are admitted to upper division and they've gone through the placement process. That placement is based on grades that they've earned in required prerequisite course. Once they have gotten that placement, as I said, then it's a year before they actually go to that distant campus, but they can then enroll in those restricted entry sophomore courses and prepare then to enroll in the upper division junior and senior courses. accumulated GPA of at least 2.75 or higher on a 4-point scale in required prerequisite courses and at least a C in all of those courses. The required courses are listed below the 2 biology courses, a microbiology course, and 2 chemistry courses, and students must have completed at least 3 of those 5 in order to apply to the upper division. They also need a 2.75 on all their MSU Bozeman work in order to be admitted. And you'll see a website there that can also help with that. So how many students do we admit? We're a large program. We have about 967 students, or exactly that many enrolled last fall, and of that, about 100 were graduate students, so about 865 pre-nursing and undergraduate students. We admit 112 students per semester, or 224 a year, and you'll see there the distribution of students. Some of those numbers include accelerated students. Those are students who already have a degree in a discipline other than nursing. You'll see our largest number of students are on our Billings campus. That's because of the 2 large clinical agencies there, the 2 large hospitals, and then not as large a number on our other campuses. So students then are actually placed on one of those campuses. We do certainly give students an opportunity to identify which campus they'd like to be placed on, but then, of course, it does need to be distributed, so if everyone selects the same campus, it doesn't work. And so we place them based on their grade point average overall. Our admission is competitive. Upper division placement last year on each of our campuses, those GPAs are listed there. You'll see they're all of above a 3.5, while Billings is very close to 3.5. So even though we say the minimum is 2.75, because we have so many applications, it is competitive, and the average GPA is significantly higher. Our graduation rates are high. When students are admitted to upper division, they do very well and progress through, and by far the majority do succeed and graduate. We do all we can to help students succeed. Our goal is that every single student will succeed and graduate, but sometimes life comes in the way and there's illness or family emergencies and aren't able to continue. You'll see there for fall 2013 that the cutoff GPA was 3.5, and of 197 applications for the 112 slots, we had 197 applications. And of those, 26 were males. We wish there were more males, and we're always hoping we'll get more males and increase the percentage of males in our among our student body. We do accept transfer students. Sometimes students will think that they have to do all their prerequisite courses here in Bozeman. That's not true. But what's important is that they do contact us, get those transcripts analyzed, to make sure they're taking the right courses so they can progress in a timely manner. And then they can go ahead and apply for upper division placement. So they do not have to be here on this campus, can be anywhere for that matter. We also do accept licensed practical nurses, and they can actually waive a couple of those sophomore level nursing courses, the nursing as a profession, and foundations of ethical practice, and then they can challenge 3 others of those sophomore level nursing courses. And there's contact information there for any LPNs who might watch this and be interested in perhaps entering the program. Our BSN curriculum can be completed in 8 semesters with good planning, so the student begins and knows when they begin their college career, and if they know they want to be a nurse, it can complete it in 8 semesters fairly easily, but it's really important to get good advising so that all the prerequisite courses are taken in a timely manner. The first 2 years are really a mixture of preparatory courses and also courses in the MSU core curriculum, those courses in the arts, sciences, humanities that are really those extra courses that are so critical to making this person a well-rounded nurse who really draws on knowledge from the liberal arts as well as the sciences and nursing theory as well. Year 2 then, at the end of the year 1 is when students apply for admission, and then at the beginning of year 3 is when they are placed on upper division, on their upper division campus and begin that study as well. Once on an upper division campus is where the clinical learning experiences take place. We also have many opportunities using high-fidelity simulation mannequins. Those experiences are available in all 5 of our campuses, and we really believe that experiences in that type of simulated setting helps lower anxiety, lower stress, so that when students then go to the clinical setting, the anxiety is down and they're better able to learn. We have access to many, many inpatient and outpatient facilities across the state that offer a wide range of clinical opportunities, learning experiences, and diversity of patient populations, so that students have a great opportunity to learn the necessary knowledge and skills to become practicing professional nurses. The costs of our program, those first 2 lines there are tuition only. They do not include room and board. So if you are a Montana resident, your tuition for this year would have been about $6,700. We do have a program fee as well as some additional expenses and an application fee as well. Our students upon graduation are prepared to sit for the licensing exam, the NCLEX RN. Our percentage that pass that are generally well above the national average, and we're pleased with that. Our students do very well. They are sought out nationally by employers, and the feedback we get from employers is a high degree of satisfaction with our graduates, and the feedback we get from our graduates is a high degree of satisfaction with their education and with being a nurse in general. I've given you some websites throughout this webinar, and here is an individual, a real name, Dr. Gretchen McNeely. She's the Associate Dean for the undergraduate program. Phone number and her email address is there, and she's real good about responding or making sure that a prospective student gets in contact with the person that he or she needs to get in contact with. This slide shows a celebration that we had last fall, or really all last year. We celebrated 75 years of nursing in the College of Nursing at MSU, and these are all our current students, and they're modeling student uniforms that have been worn through our 75-year-old history. And you'll see the gentleman on the far left is a male student. He's a current student. And we wanted to emphasize that there are certainly males who go into nursing, and that we have them here, and he is modeling our current uniform as well. We had a lot of fun that night. So I want to thank you for this opportunity to tell you about the College of Nursing at Montana State University. I've been a nurse for many years and have found it an incredibly exciting career. It's taken me places I certainly never dreamed of, and I hope that you too will continue to explore this very wonderful profession. So thank you.
Thank you, Dr. Mellon. So now we'd like to open it up for any other questions. And as you can see, you are welcome to type any questions into our chat box. We have quite a few that were coming through during your presentation, so I will start with those. One question we had was, how do the students stay in touch with their advisors or support services when they're away from the Bozeman campus?
Well, that's a good question. The advisors are on the campuses where the students are placed, so they will have advisors on those campuses. Every campus has got administrative staff that advise students as well, who are trained in advisement. So they're where the students are.
All right, that's very helpful. And what happens if the students aren't placed in upper division courses? Do they have the opportunity to reapply?
Oh, yeah, absolutely. And several of them do. Sometimes they'll go and they'll retake. If their GPA isn't quite what they'd like it to be, sometimes they got a C in that chemistry course or whatever, they'll go and retake a course or two and try and increase that GPA and then reapply. And we have many that do that. We also have a wait list every year, so if they don't get in, not all students accept placement, because a lot of times students apply to more than one school. So sometimes even those who didn't get in right away, they'll get in, and then before school actually starts, because they've been placed on a wait list.
Okay, and this question is for either of you. Do you hold preference for in-state or out-of-state students whenever it comes to placing the students for upper division?
I can answer that for MSU. There is no preference given. The admission is based solely on grades. There's a formula. We use a software program. The grades go in the computer and process that data, so there is no preference.
And from Carol's perspective, you do need to be enrolled as a student in the so you may be bringing in, let's say, 60 credits from a school out of state or a school other than Carroll. And 60 is the maximum number of credits that Carroll College will accept. But it doesn't make any difference where those credits are coming from. Well, the registrar's office is the one who has ultimate say-so over which credits can come in or not. But as far as the location, what state you're in, there's no preference given there.
All right, and we had one presenter requesting that you review the specific nursing courses that you have in your curriculum.
Okay. Let's see. I can do that for MSU. We've got those 4 lower division nursing courses. So there's nursing as a profession, foundations of ethical nursing, the foundations of planning and finding care. That's a basic foundations course. Pathophysiology, health assessment. Our students take a 3-credit pharmacology course. They take an introductory psychosocial 3-credit nursing course. Then they have nursing care of the child and family, nursing care of children and families in acute and chronic illness, a community, an introduction to community-based nursing, and then also population-based nursing care. So one course. So one of those is at junior level, one senior level. They take a research course. They have an issues and health policies course, psychiatric nursing course, a care management course, a complex med-surg course as seniors called urgent and palliative care. Mention the population-based nursing care in the community, and then the last semester they take a nursing leadership and management course. I think I got everything. I don't know if I mentioned an initial medical surgical nursing. It's called acute and chronic illness, but it's basically med-surg.
Very impressive. Thank you for sharing those.
Wow, and here's the Carroll lineup starting in that 200 level courses. Fundamentals in Health Promotion, which is a class which has a lab. Assessment in Health Promotion also has a lab, both on campus and off campus. Care of the Family, Psychosocial Health, Pathophysiology and Pharmacology, Evidence-Based Practice Research Methods. Now we're in the junior level. Illness Across the Lifespan 1, which is a focus on chronic illness, and that also there's a 4-credit clinical nursing care 1 class that goes along with the illness class. At the 400 level, we have an Illness Across the Lifespan 2 and a clinical nursing 2 class that accompanies that, and that is a focus on acute care, heavy clinical and lab with that class. Nursing Leadership and Management, Community Health Nursing, a Comprehensive Nursing Review, which is a semester-long course to prepare students, helping them review to take the NCLEX RN exam, and a capstone clinical. So those are it's about 55 credits of nursing classes. You need 122 credits to graduate from Carroll College. And we have our liberal arts classes that thread all the way across the 4-year curriculum. So we don't do like 2 years of prereqs and core classes and then 2 years of nursing. We kind of weave those liberal arts classes all the way through. So you might be a senior taking your capstone clinical and your community health class and a history class and a theology class or whatever you need to have in order to graduate. That answers your question.
That does. Thank you. Another question for Dr. Mellon. How are the students split up between Billings Clinic and St. Vincent's Hospitals?
I don't think they're really split. It depends on the course they're taking. One of those hospitals has strong or pediatrics, med surg. So they go to both hospitals, I'm quite sure. So it isn't an either or. It really depends on the clinical experience.
Okay, and this question is for both of you. Do you have preference for students that have already been CNAs, or is that something that's highly valuable for them to complete before they even apply for their freshman year?
I can tell you from Carol's perspective, no, we do not give preference for students who have certification as a CNA. I would certainly recommend it. It's a way to find out, is this something that it gives you just a taste of maybe a little bit what nursing can be all about, although it's truly just a taste. But that's important for students to know. Is this something that I truly am interested in learning more about and becoming more skilled with my clinical skills and with my skill set for nursing? But no, we don't require that for our admission.
And I can speak for MSU, we don't either. And I would echo basically what Jennifer said, but no, it is not part of our admission process.
All right, thanks for answering that question as well. Looks like we might be done with all of our questions that are coming through. So I would just like to thank both Dr. Elison from Carroll College and Dr. Mellon from Montana State University again for presenting. And this webinar will be archived and located on the Montana CAHN website, which you can see on the slide in front of you. And also we encourage everyone who's interested in keeping up with our APIN work to visit our Facebook page. And also we are found on Twitter. So again, thank you both for presenting, and thank you, Sandy, for introducing them. And hopefully, if you guys have any other follow-up questions, you can feel free to email us or go to the information that both Dr. Elison and Dr. Mellon provided you for their contact information. So with that, we will conclude our webinar. Thank you all again for presenting.